Welcome to our May installment of the AHA Team Training Monthly Webinar Series. My name is Rachel Vandervoort, and I work on the team training program here at the AHA. Very excited that we have Eric Hexdall with us from Duke University, or Duke Regional Health, and he is going to talk to us more about the employee experience, some well-being programs, and lots of good insight and information there. But before that, we have to get through a few housekeeping items. So for rules of engagement, if you're hearing me, congrats, you are connected to audio. If for some reason you need to switch up the method or you have issues, down at the bottom of your screen, you'll see a toolbar. On the left-hand side, there should be an audio control there, and you can switch from phone to computer or computer to phone. You are in a listen-only mode today, but as you can see, that chat is active. Feel free to chat in questions, comments at any point during the presentation. If it's something technical, we'll get to it right away. If it's more content related, we will save it for the end when we will do a Q&A as time allows. If there are any questions that we aren't able to answer on the presentation, we will follow up with those and get you answered via email. Today, we are happy to provide 1 hour of continuing education credit for this attendance. You'll see a code and a phone number on your screen. So after this presentation is done, please text T as in Thomas, A as in Apple, K as in Kangaroo, C as in Charlie, E as in Ewok, W as in Wiper to 919-213-8033. We'll repeat all that at the end. Don't worry, but just want everyone to know that there is CE credit available for today. Before we get into content, we like to talk about what's coming up next. So we do have some in-person master trainer courses, 2 days of really intense but really great content, activities, learning, planning, ideating with your team. And of course, our monthly webinar series continues in June with Therapist Secret, combining family system theories with team steps for effective teams. That should be a very interesting presentation. I've just read the liner notes and I'm already excited. So if you have an idea for a webinar, feel free to click on that speaker interest form hyperlink. That link and all hyperlinks you see on your screen are active, so that will open in a new window and get you straight to the information. If you're looking for something a little bit more bespoke, we do have our advisory services as an opportunity here with team training. We can come to you both in person, and we do virtual coaching calls. And really, it's about developing a relationship with an organization to come up with a very customized solution. So I think next slide, I think we are ready to just jump on in. So without further ado, I will hand it over to our speaker today. We have Eric Hexdall, the program manager of the Caring for Each Other program at Duke Regional Hospital. Thanks for joining us, Eric. Please take it away.
Thanks so much, Rachel, and welcome everyone. It's so great to see you all today. I was looking through the list of attendees, and what an amazingly diverse group we have with us today. So good morning, good afternoon, good evening, wherever you are in the world. We have everyone, for a lot of people from the US, Canada, Japan, Lebanon. Welcome everyone. It is great to see such an amazing group of folks gathered here today. Like Rachel said, my name is Eric Hexdall. I am a nurse by training. At present, I work at Duke Regional Hospital as the program manager for the Caring for Each Other peer support program. And I'll tell you a lot more about that later on. By way of background, I'm a second career nurse. I'm also a retired military officer and did something completely unrelated to nursing before I came to nursing. And so all that aside, and if I can get the controls right, what I'd like to talk a little bit about today is kind of what burnout looks like among healthcare workers, and really how the COVID pandemic, as challenging as it was, opened up some new ideas and some new opportunities for growth and well-being programs. The majority of what we'll talk about today is the Employee Experience Hub at Duke Health, kind of everything that we offer our employees as far as well-being. And then we'll talk a little bit about how we're starting to collaborate with other service providers Just by way of brief background about Duke Health, we're a pretty good sized health system. We are the second largest private employer in the state of North Carolina, the first largest being Walmart, which I guess is pretty common throughout the US. We have over 26,000 full-time employees, more than 11,000 at Duke University Medical Center alone. We have 3 hospitals in the Duke system: Duke University Hospital, Duke Health Raleigh, and Duke Regional Hospital, where I work. I've kind of been back and forth between Duke Regional and Duke University Hospital throughout my career. I've been in the health system for 20 years now. We have 3 ambulatory surgery centers, an entire primary care network, and Duke Health Integrated Practice with over 140 primary and specialty clinics. We also house the Duke Clinical Research Institute and all of the other things that you see here: Duke Children's, Duke Integrated Medicine, School of Medicine and Nursing, and a very robust home care and hospice program. So that's just a little bit about us. So I would love to know, of all the awesome people we have here today, if you could put in the chat just briefly, what is it that initially drew you to healthcare? 1 or 2 words, maybe a brief sentence. What initially pulled you into healthcare? Jen says relationships. Rebecca, helping others, helping people, caring for people, service, teaching people, making a difference, creating x-rays. I love it. Fixing things, a fixer, yeah. Caregiver, people, knowing more about medicine. Deborah says service. Patient safety. Deborah, awesome. Yeah. Paying it forward. Shannon, I love it. Helping individuals. Oh, Amy, to pay back after nurses and docs saved my son's life. It was wonderful. Mary, your mom was a nurse, loved taking care of people. So people and healing in all ways. I love it. Yes. So to many of us, when we got into healthcare, it looked like this. And then this is, many of our visions still, as we can see everybody putting all these wonderful comments in the chat. So healthcare looks a lot like caring for one another, taking care of patients, doing what we love to do, making a difference in people's lives. And healthcare also looks like this. First, I'd like to give a little hat tip to my crosstown colleagues. The nurse in the picture is a nurse named Grace from UNC, our lighter blue colleagues across town. And I think we have some UNC folks on the call, at least registered today. So, hey guys, I was looking for nursing photos from COVID, and this one just jumped out at me. This is like your quintessential awesome COVID nurse, just putting her head in and taking care of business. I did notice, I couldn't help but notice that nobody put in the chat that I wanted to be part of the front lines of a pandemic, nor did anyone put in, I would like to be struck by a dementia patient or anything like that. So on the other side there, opposite the photo, this is from 2020, so statistics are a little bit dated, but you can see where hospitals and nursing and residential care facilities fall as far as non-fatal assaults and violent acts. A little more recent statistics from 2023 by survey: 81.6% of nurses have experienced at least one type of workplace violence. 45% reported an increase in workplace violence on their unit. And I don't know, I don't think we're unique in at least subjectively seeing an increase in the intensity and the volume of violence against our caregivers, which can lead to something like this. This is from the CDC website, updated 2023, but the statistics are as of 2022, nearly half of all healthcare workers reported often feeling burned out in 2022. And of course, this is on the tail end of the pandemic as it was sort of winding down. Nearly half of all healthcare workers intended to look for a new job in 2022. Again, I don't think we're unique in seeing quite a bit of turnover during the pandemic. So all of these challenges can lead to burnout and turnover. This is a little bit of foreshadowing from a little bit later on. We'll talk about Brian Sexton in a little bit more detail, but we have here at Duke the Center for Advancement of Wellbeing Science, and Brian Sexton is the psychologist who's kind of runs that. But this is one of numerous studies that he has done, and I just want to call your attention to a couple of things. A bit of a busy slide, but some results. participants in one of his studies. Just have a look at the N up there. Between 2019 and 2022, 107,122 participants, upper 30s and lower 30,000s in each bracket there. So this is a pretty well-powered study. In 2019, 31.8% of people reported feeling burned out. 2020, it's up to 34.6%. 21, 22, 40.4%. Specifically nurses, and I saw just over half of our participants are nurses. 2019, over 40%. 2020, over 45%. 2021, 22, almost 50% reporting burnout. The other statistics that Dr. Sexton himself found interesting was that attending physicians actually saw a dip in reporting burnout in 2020, but then they went up and kind of joined everyone else. And the study also looked at how people viewed their coworkers as far as emotional exhaustion. So interestingly, overall, way more people viewed their being a climate of emotional exhaustion in their particular unit than were reporting emotional exhaustion or burnout themselves. Almost 75% of nurses reported a climate of burnout on their unit. So this is sort of what we're working with towards the end of COVID. So just kind of setting the stage for how we go about taking care of our people. This is from the healthcare workforce scan from the American Hospital Association in 2023. And it's a great call out that this huge disruption in healthcare, all these incredible challenges also created unique opportunities for accelerating change if we want to nurture a willingness to embrace self-care. And I want to talk a second about self-care. When I first came to work in this position, I did a debrief for a kind of a traumatic code in our ICU, and I named self-care. And some of the feedback that I got was that self-care got tossed around quite a bit during COVID. And we did our best to offer self-care to our employees, and at the same time, to some of the employees, it was almost perceived as a Band-Aid. And the assistant nurse manager that named this to me actually said sometimes it sounds like victim blaming, which I never thought of. And it was just an interesting perspective to hear from our frontline caregivers about self-care. So now when I talk about it, I like to throw in the caveat that it's not designed as a Band-Aid. It's not to sort of patch you up like a cut man in a boxing ring and put you back in the fight. We offer self-care to our employees with the mind of helping them fill their cup back up, so they can continue to give from the abundance that they give, and from all of the things that you all put in the chat, the things that drew them to healthcare in the first place. Self-care is all about replenishing to enable people to bring everything they can to take care of our patients, to realize that taking care of themselves is important as taking care of their patients, to try to overcome some of this reluctance. There's kind of a stigma sometimes associated with seeking help, especially in some groups. Really naming and acknowledging all the pressure and the stress that we face now, and developing a wide variety of educational programs and a huge menu of things that I hope we're going to talk about a little bit later on. So the employee experience at Duke, I'm going to break down into three categories. First is diversity, equity, inclusion, and belonging, because that's a big piece of it. Our workplace safety, and then we'll move on to employee well-being. And before we do that, there's a brief poll question that I think Rachel's going to run. And I wonder if you have ever benefited from an employee well-being or wellness resource in your institution. So if you could just take a moment, click yes, no, and if you don't know, you can click unsure. And we'll give everybody just a couple of minutes to answer the poll. And while we're doing that, maybe I'll go on to the next slide. Oh, there we are. Oh, so great. So most people say yes, that's great. Great to hear. About a quarter of us are saying no, and a couple of us are not really sure. Maybe we're not sure if a resource that we took advantage of actually falls into an employee well-being or wellness resource. But yeah, great numbers. So it's nice to see that the people that are participating are taking advantage of those things. Thanks, Rachel. So I want to talk a little bit about the diversity, equity, inclusion, and belonging program here in the Duke Health System. First, diversity is one of our core values. Our core value, I don't want to sound too core value-y, so to speak, but our core values here at Duke are teamwork, integrity, diversity is right in the center, excellence, and safety. We place great value on diversity. Some examples of this in 2020, we started a program called Moments to Movements. This was after the killing of George Floyd. And it was a collective stand against systemic racism and injustice. And we've had a lot of employee engagement with that. We have a number of Duke Health affinity groups. And this is for everything from administrative professionals. We were just involved in their appreciation week where we talked about setting boundaries and self-care. Asian American and Pacific Islanders, they just unveiled this beautiful mural here at Duke Regional for them. We have Black Debate, we have LGBTQIA Alliance, we have Duke Minds, which is for young professionals. We have Juntos, which is together in Spanish for the Latin community, Latina community. We have a Women in Leadership group. We have Duke Moms that was started by one of our people and patient or employee experience, Duke Military Association, which I belong to. They all have their own activities, everything from administrative professionals, breakfast, self-care. Duke Military Association meets monthly at this little grill right around the corner from our hospital here. So a little bit about the hospital that I work in. Duke Regional Hospital was initially built in 1976 as Durham County General Hospital, and that was when we actually merged Watts Hospital, which was the whites only hospital in Durham, and Lincoln Hospital, which was primarily black. So in 1976, that happened. Fast forward to 2023, Duke Regional Hospital was named the most socially responsible hospital in America. So a little bit of bragging rights for our folks who front that up. We also monitor diversity metrics on an ongoing basis. We look at the diversity of our leadership, how diverse our vendors are. Right now we're in the middle of our most recent Culture Pulse survey that's looking at employees' sense of belonging and commitment. So we do have a really strong commitment to diversity, equity, inclusion, belonging, and an entire group dedicated to that here in the Duke Health System. Moving on to workplace safety, and we talked a bit about the violence and how people feel about that. Our last Culture Pulse survey a couple of years ago, our employees really called out safety as a primary concern of theirs, and partly in response to that, we developed a workplace safety committee for each entity, each inpatient hospital. We have long offered CPI, Crisis Prevention Institute training for the people who are most likely to encounter workplace violence. We're now here at Duke Regional, at least requiring it for all of our inpatient staff. Recently, within about the past year or so, we put a weapons detection system in, and that was in direct response to that Culture Pulse survey as well. So we control public access to all of our hospitals, and every member of the public who comes in goes through the weapons detection system, which has proven itself quite effective. We recently conducted active shooter drills, which is an unfortunate reality, but in this day and age here in America, but we did one of those in each hospital, and our Caring for Each Other team was standing by for that. In each hospital, we now have a behavioral emergency response team. At Duke Raleigh, they call it the TCT, the Therapeutic Containment Team, but this is a team that can respond to disruptive people. We also have very robust resources and help for staff who experience domestic violence, and unfortunately, that's a reality too. Our staff are a microcosm of the population, and we run into some of that sometimes as well. The Duke Police has a very robust system where they do everything from escort, transport services, victim assistance, crime prevention workshops. Moving back to the behavioral response for a second, we also have behavioral health rounding nurses who have sort of put people on their radar who might need additional attention and round on those on a regular basis. So that is kind of a snapshot of our workplace safety commitment, which again is part of our employee experience hub here at Duke. So moving on to well-being, and there are a couple of questions that came in, hopefully that will get addressed in this section here. The program that I belong to specifically is the Caring for Each Other program. Caring for Each Other started in 2017 at Duke Hospital as a collaboration between the CNO, the Chief Nursing Officer at the time, the head of chaplain services, and our clinical social work. And it was piloted then as a 24/7 response to an event that might involve a second victim experience. So an event that might involve patient harm where staff might be blaming themselves. And it was staffed by, completely staffed by volunteers. And this is again only at Duke University Hospital. Our current state is that we have a program manager at each hospital entity. So myself at Duke Regional, my colleague Ashley at Duke University Hospital, and Lauren at Duke Raleigh, and our supervisor Kristen Lakis, who is, you may have heard her name. She's a pretty well-known figure in resilience and well-being here. She kind of is our overall supervisor, and she takes care of all of the other things that you saw, all of the outlying clinics and all that. So we provide peer support on a 24/7 basis. We are in the hospitals 5 days a week, and we are also on call 24 hours a day for after hours emergencies. We have our peer support volunteers, which we're in the process of sort of ramping up. It started in June of 2021 as a training for staff members who felt called to support their colleagues. We conduct regular training. And right now, since we are all, like my position is new as of January of this year, because this is kind of a new program here at Duke, we're trying to, as much as we can, health systemize the peer support volunteers and sort of what the workflow looks like. So we're going to be tapping into them more and more. And these are, for the most part, frontline caregivers who just, again, feel a passion for supporting our staff. We offer regular education, like I said, both for managers and for staff. It's great for the managers when an employee comes to them with a problem. We teach supportive communication, active listening, and things like that. We have a Caring for Each Other fund that employees can tap into if they experience a sudden catastrophe like a fire in their house, or they wreck their only form of transportation or something like that. They can tap into our Caring for Each Other fund, and it's a one-time grant to just kind of get people over the hump. We also have conversations with colleagues, and this is something that we do in response to current events. The latest one that we have going is on the situation in Gaza and all of the protests that you all probably saw around the country, some of which were at UNC and Duke. So this particular one is going to be a conversation with one of our physicians who's actually volunteered over there. But we have conducted these conversations with colleagues in response to other events, like just very socially impactful events that happen, things that get a lot of media attention. We also have a program called Professionalism and Restorative Justice, and we have two incredible team members, one of whom is responsible for physician professionalism, and another one who kind of oversees professionalism among all the other professions. And so this is where we get a professional conduct report. We have a peer messenger program that we can deploy. So if a report is made of unprofessional conduct, one of these people, depending on the profession of the individual, will look into that and then possibly deploy a peer messenger just to kind of speak with that person and see where they're coming from, and help them understand how their conduct might be landing. We have a restorative justice program as well. So this is where we run into, sometimes if there's a cultural problem on a unit where there's either a culture clash or a clash between two groups of people or two professions. We have one of our colleagues named Arius Murray Rowe, who also runs the professionalism for the non-physicians. has a robust restorative justice program that was actually established by Melissa Siegel, who unfortunately recently left us, but is still happily in a consulting position for us. We also have an annual grief symposium to help us address grief. Oops, sorry about that. To help us address employee grief. This is a largely unnamed phenomenon, but if we, especially for our acute care colleagues who, and especially during COVID, where we saw so much tragedy, and grief in many ways just really wasn't named and addressed. So we have an annual grief symposium that's dedicated just to that. On top of that, so the caring for each other, just to kind of rehash that, I'm a frontline caregiver and I and my colleagues in CFEO are frontline caregivers who offer in the moment peer support for people who need it. We're the ones who've kind of been in the trenches, and we can empathize and support people who are maybe just having a difficult day or a difficult time with a particular event. We also have professional mental health counselors who are on call 24 hours a day as well. And that is our PAS program, which is our employee assistant program. These are just an amazing group of people who are completely dedicated to the mental wellness of our employees. PAS was actually established at Duke Hospital in 1984, so it's been around quite a while, and a lot of our folks take advantage of it. Duke Raleigh was contracting it, but it's health system wide. We've been in Duke Raleigh since 2022. This is free, confidential, short-term counseling for employees and immediate family members. They get up to 8 sessions free of charge and referral to long-term counseling as needed. And there was a question that came in advance about critical incident response. PAS also provides, kind of heads up our critical incident response program. So the caring for each other like we do is for quote unquote everyday stuff. Critical incident response is for the really impactful things like shootings, sudden unexpected deaths of colleagues, very emotionally impactful medical events, like an event where there's just a lot of blood everywhere, things like that. That's where we would consider deploying a critical incident response. And that's where we send out not just one, but a group of at least 2, usually 3 people to go through sort of a structured critical incident response, if you're familiar with that sort of algorithm or structure. They provide education as well. Lori, who is my great colleague, who's our PAS counselor here at Regional, does a mini mental makeover once a month, where she just sits down and does some mindfulness education, and it's open to anybody in the health system. So that's our employee assistance program and our caring for each other program. The other really amazing resource that we have here, or another one, is the Center for Advancement of Wellbeing Science. Used to be called for the Duke Center for Healthcare Safety and Quality, HSQ, recently was renamed the Center for Advancement of Wellbeing Science. Among other things, they stood up a wellbeing ambassador training. So this was an 8-hour training that people could come to. This was in person, obviously, prior to COVID, and just learn about the different well-being tools that we have available, and sort of be an ambassador for their unit's well-being. And we have a monthly webinar where all the people who have been through this training get together and talk about just some of the great things that people are doing kind of as a grassroots well-being activities on their units. Currently, they operate what's called the WellBe Essentials course, which began in COVID in 2021. It's an online course, monthly webinars, and coming soon, they're going to offer an internal Duke well-being certification for staff members, which is really exciting. It's just going to be a formal acknowledgement and hopefully kind of a bullet point for people's clinical ladder and things like that. And maybe a stepping stone to other things for staff. So that's kind of on the horizon. Center for Advancement of Wellbeing Science, CAUSE for short, also offers leadership coaching, and they have a resource that is open to all of you, open to anybody who wants it, called Bite-Sized Wellbeing Tools. And I'm going to just advance here to show you a little bit of those. This is just a screenshot. Sorry if it's a little busy, but if Rachel would be so kind as to put that link in the chat, and maybe also, I think I sent it to Kara in advance, and if it doesn't make it in the chat, that's fine. We'll send it out afterwards. But if you click on that link, you can access any of these well-being tools. These are all evidence-based, and one of the really cool things about them is when you do them, you are also offered the opportunity to participate in the research, some of which you saw on that really busy slide in advance, which had that massive N number. So you are offered the chance to participate in the ongoing research that this group is doing around all of these tools. And you can see on here everything from cultivating joy. And it's set up where it will send you a daily reminder to do a particular activity. Everything from that to gratitude, writing your own burnout story, which is one of the things that we did in the well-being ambassador training, which is surprisingly effective. There's the signature strengths tool, which is great. So often we don't think about our strengths. We think more about, what we did wrong or whatever. So this is an opportunity to sit down and talk about what your strengths are and how to engage them in your work. Cultivating kindness, self-compassion. Don't we need more of that? Anyway, so these are tools that are available to anyone, and especially any healthcare professional. Would love for you guys to take advantage of these things. The more people know about them, the better, and you're welcome to use them. So a little bit more about Brian. That's pretty new picture of him, I guess. They have over 180 peer-reviewed articles, many of them driven by the data from the tools that I just showed you guys. And there's just a smattering of the latest ones. Latest one, November of 2023, they just published. And they have received funding from the Dr. Lorna Breen Act, which was our wonderful colleague in New York who took her own life in the height of COVID. And in the wake of that, this act was passed where there's funding for well-being research, and we're one of the beneficiaries of that tragedy. As sad as it was, this is something good that's coming out of it. So I think we're pretty good on time. So our human resources department also has a robust health and wellness program. They have what's called the Live for Life program. Live for Life offers nutrition counseling, tobacco cessation, exercise programs. They offer health and well-being coaching. So we'll get to integrated medicine in a second, but our Duke Integrated Medicine team has an entire course on health and well-being coaching, which if you get a chance to take it, is well worth your time. I took it last year. I'm a happy graduate. I use the skills every day, but we have graduates of that program that can help people work on their own well-being, whatever their well-being goals, whether it's weight loss, more exercise, getting better sleep, things like that. So these are some of the resources. One of the pictures you see there is the Duke Farmers Market. We bring in to Duke University Hospital during the summer, locally farmed produce. A lot of it's pesticide-free, organic. A lot of other vendors come in, everything from coffee to milk delivery to these really great pastries that they bring. Anyway, so you have to kind of experience it to really appreciate it. But this is just another example of the things that we offer to our employees. So if this all sounds like a very well-oiled machine that works together spectacularly, let me burst that bubble. Really what it is a number of well-oiled machines that work really, really well. And of course, in a health system this size, we're going to have all kinds of resources that grow up that work really, really well. And the next step really is to kind of coordinate all of this. And you see Dr. Ian Brown, Ian Brown there is our Vice President and Chief Employee Experience Officer. I put him up there just to put his face in front of you. If you ever get a chance to hear him speak, he has the most amazing, inspiring story that you can imagine. He spoke at our safety conference, the health system safety conference last year, and it was very moving and quite inspiring. but now here he is in charge of all this, and he and his team is in the process of kind of gently corralling all of these things and bringing them into one umbrella. So really that we can work together in a more holistic way that really puts the well-being of our team members front and center. How do we build that community of care and belonging with our diversity, equity, and belonging groups? How do we integrate that into all of the well-being things that we offer? One of the things that I encounter consistently when I round, and all of us do regular rounding in our hospitals, is, wow, we do that? We offer that? That's really cool. So a big part of what we do is education, just letting people know all of the things that we have. In fact, when I was putting this together, I took a moment when I had all the slides together and just sat back and said, my goodness, we offer a lot of things. So this is, part of our job is to just get the word out about that. And ultimately make this part of how we sustain our team members, how we sustain our talent force, how we keep everybody engaged and take care of everyone, really. Especially coming out of all the challenges with the pandemic and the increased violence and everything that we talked about earlier. And hopefully eventually turn this into that well-oiled machine that we envision. And this aligns directly with our strategic priorities, recently kind of simplified in response to a very large employee engagement survey that we did that was facilitated with multiple conversations with frontline caregivers. And the three things that we're trying to put first now are, number one, putting our people first. How do we take care of our folks? How do we be clear in our expectations, our guidelines? How do we empower our folks and that speaks to the just culture, I think that we might talk about in a second. And how do we adapt? All of these things that I've just shown you, this is a snapshot in time. We're constantly in the PDSA cycle of this. Does this work? If it's working, great. Let's keep building on it. If it doesn't work, how do we improve it? How do we improve the process? How do we improve what we offer to employees? So this is kind of how we're trying to pull all of these resources together, kind of engage everyone, get everybody singing off the same sheet of music, so to speak. And so that's kind of what's on the horizon for us. Another thing that we're going to be, and I mentioned our culture pulse surveys a little bit earlier, that was run by Human Resources. We're actually bringing that into the employee experience team the next time we do it. In fact, at this point, one of our team members has actually taken it over and is front and center with the culture pulse. Our employee appreciation functions, which I'll show you a snapshot of in just a second. Duke Well, which is a program that we offer to Duke patients, and it's management is part of it is management of, long-term management of chronic healthcare challenges or health challenges, but also offers resources to people who are maybe unhoused and are Duke patients, or are food insecure and are Duke patients. And we just about a month and a half ago had a conversation with our Duke Well colleagues, and the light bulb went off for them, and they said, "Oh my goodness, almost all of our employees are also Duke patients because they take advantage of our healthcare here. We can offer all these benefits to our Duke employees too." So now we're having that conversation with Duke Well. We are getting ready to increase our partnership with Duke Integrated Medicine, which is it's located on the Duke University campus, but a little bit distant from Duke University Hospital. They offer holistic healthcare. They do primary care, psychotherapy. They offer yoga. They offer health coaching to their patients. They offer acupuncture. They also offer a lot of training, mindfulness-based stress reduction, which I also took a number of years ago, life-changing, based on John Kabat-Zinn's model of MBSR. They're teaching biofield work like Reiki and trauma tapping, and also that health and well-being coaching that I mentioned. And so this is my turn to learn from you all. I would love to hear from you all. What is, at least in your opinion, the most impactful employee experience or well-being resource at your institution? And you can put it in the chat. Oh, a couple of mindfulness training, care, community grade. And there was a question, are any of the services offered at Duke well covered under the insurance? Elizabeth, yes, it is. If our employees are covered by Duke Insurance, it does cover it, absolutely. Anything that facilitates connection and communication, a couple of EAPs, that's great. Nancy, you have a dynamic employee assistance program. That's great to hear. Kimberly, Caravan Wellness. I like that. I'd be interested to learn more about that. Kate says, stepping in for respect to DEI training. Oh, that's great. Kind of like a, what's the word? Bystander training type of thing. Jennifer says employee recognition. Jamal, EAP and employee advocates. A lot of EAPs coming in. Yes, a wonderful service. Aaron, near peer therapy. I like that. And support. Yeah. EAP. Brianna says we don't have any. The closest we have is employees committee and occasionally counseling and help in times of crisis. So yeah, a whole spectrum of offerings here. EAP. Tracy says an employee wellness program. Oh, Christopher, a code lavender, free counseling chaplains. That's a resource I didn't even touch on, but very excited that now at Duke Regional Hospital, we're starting our own chaplain training program here. We've had 2 full-time chaplains for many years, and they're on call quite a bit, and they are just over the moon to get this chaplain training program, and that's done in partnership with our Duke Raleigh colleagues as well. Team resiliency advisory councils, Sherry says. Resiliency rounding, Mary. Joanne, RISE team, resiliency and stressful events. Guys, these are great. Tamara, debriefing teams. Oops. Mary says compassion champions. Professional fulfillment book club, Mary Alice, that's great. Mary Alice, Schwartz rounds too. Yeah, I didn't mention those. We used to do Schwartz rounds. They morphed into something called compassionate care conferences. They went away with COVID, and we're very excited to be restarting those at Duke Regional Hospital in June. And a lot of great answers. Third conversation focuses on building bidirectional empathy. Jen, thanks for that. Advisory councils, Code Lavender. Somebody help me under, what is a Code Lavender? I'm interested in that. You can just type it in the chat if you get a chance. Anyway, so to kind of bring everything back around, oh, there we are. Oh, psychological first, oh, great. Okay, PFA, nice, good to hear. I like that, yeah. That might be something that we can look at as well. So what I hope you all are taking away from this is maybe consider viewing your employee experience holistically. And I'm not saying that we are all the way there. This is definitely a work in progress, but that's what we're starting to do, is to look at all of these resources and look at them from a higher level and see really what we bring to the table as far as taking care of our people. We do have to evolve these things, meet our employees' current needs, and we are so looking forward to increased collaboration with a lot of these partners. So I hope this is something that you're taking away from this. And I want to leave you guys with just one thing. This is happening today as we speak at Duke Regional Hospital. As part of our employee or team member appreciation month, they brought in a local North Carolina barbecue, and you haven't lived until you've had North Carolina barbecue. So this is just some shots from that. This is our Live for Life folks on the lower left, that Healthy Duke. And on the far right, yes, that is a giant vat of North Carolina vanilla pudding. And so I couldn't help but include that just to make everybody jealous if you've ever had this. And with that, I want to thank everybody so much for your attention. Thank you for jumping on. Let's go back for just a second. And I do want to take a moment. There was a question that came in. There were 2 questions that came in kind of in advance, and I hope that I answered those. If not, please feel free to chat right into the chat.
Wow, I can actually queue up a
Thanks for
couple of
Caravan
them for
Wellness.
you.
I'm going to click on that and bookmark it right now. Thanks, Kimberly. And so somebody mentioned something about just culture. There was a question about just culture and how that supports employee well-being. In the job immediately prior to this, I worked in the patient safety department at Duke University Hospital under the very able direction of Kara Levine, and I'm not just saying that because I think she's on a call. Kara is a very well-known figure in patient safety, and I was lucky enough to be a part of that team and really learn from her. And one of the things that uh, I saw firsthand that we do well pretty much from the top down is just culture. If you're not familiar with that, that is the idea of holding the system accountable for events as much or more than we hold employees accountable. So when something happens that's adverse, we don't just blame the team member. We do certainly look at individual accountability, but we also look at individual accountability in the context of that individual, that human being, as we all are until ChatGPT replaces us anyway. But that human being working in a system that's also designed by human beings. That many times we design a system and we sort of cling to it because we think it's a great system, and then come to understand that system might need a little bit of revision based on events. So just culture is the idea of really when an event happens or when anything happens that gets our attention, not only do we look at individual accountability, but we also look at system accountability. And I'm proud to say that for the root cause analyses that I was part of, that's one of the big things that we did in patient safety. We kept an environment of psychological safety to the point where we could have very rich interprofessional conversations about exactly what happened, what went wrong system-wise, how the system influenced subsequent human behavior, and what we can do because we're never going to get rid of mistakes in healthcare. How do we modify the system to minimize the possibility of the inevitable human error getting through to people? And so that's the idea of just culture, and it's an algorithm. We didn't make it up. We use it. And I'm not sure if you remember, Kara, if you remember the people who actually put it out. You can put it in the chat if you're on. Whoops, sorry about that. I got carried away with my scroll button. And some great comments about just culture. And thank you for the explanation of Code Lavender. I'm actually going to bring that back. I think that's a great idea. And thank you for that learning. I really appreciate it. And again, with that, I want to thank the American Hospital Association for the opportunity to speak with you guys today. Thank you so much for joining. I so appreciate all of you and everything that you do. What an awesome group of healthcare professionals we have. I will turn it back to Rachel. If anybody has any questions, I think we do have some time. Please feel free to put them in the chat. And I will turn it back to Rachel.
Excellent. Thank you so much, Eric. Lots of good information. Like you said, lots of little machines, moving parts, all working together. Really glad you brought up just culture. There was a question/comment from Elizabeth Murray earlier in the presentation. She says, engagement in well-being programs can be a challenge and influenced by culture. Would you please comment on how long it takes to create a culture of wellness, even when all the best practices are in place? And I think that is a really good question, because just because you create the resources doesn't mean people engage. So what was the culture experience like at Duke? I think you might be other go.
Say that one more time. What was the culture?
So when you started building these wellness programs, did people engage with them right away? Was it very well received? How long did it take the culture of we are supporting and we are participating to come about? Was that an easy lift for Duke? And do you have any recommendations for other organizations where that might be a struggle, where it's not as part of the culture yet?
Yeah, no, this is as you hopefully saw, this is a huge undertaking and a huge, very broad mechanism from a variety of different spots, everything from human resources to our employee occupational health folks, to us and caring for each other, to our PAS, our employee assistance program colleagues. So this took a long time to build, and hopefully I gave a little bit of the history in the presentation. The caring for each other was kind of a grassroots thing that came out of one of our chaplains at Duke University Hospital, who noticed a need for people to debrief, for frontline caregivers to debrief significant events. And that's how that really grew. It grew first at Duke University Hospital. Again, it started with volunteers, but it became so well received that we expanded it to the other hospitals too. And again, just recently got another program manager, has been at Duke Raleigh for 2 years. I've been at Duke Regional since January, mid-January of this year. University Hospital started it. They've had the program manager for a little bit longer, but now we are right now in the process, and we have weekly meetings. We share learnings. We talk about how things are going in all over the health system. What are we seeing? Right now, I don't know if you guys heard the overhead. We had a behavioral emergency response. The things that we're seeing, we respond to the things that we see. We have a lot of long stay patients with behavioral challenges that we can't place, and so they call these birds on them pretty regularly, and the staff really are getting worn out by it. So one of the things that I do, and a lot of us do, is we don't respond directly to them, but we'll go up afterwards and just check in on the staff and let them know that the resource is there. And many times good conversations start with that. I'm kind of meandering, but as far as how to build a program like this, I would start by listening to the employees and what they need, and doing a little bit of, digging into the literature. What sort of things are other people offering? What sort of things are effective? Maybe start with on the Center for Advancement of Wellbeing Science. What are the things that is some very solid, I mean, that's bulletproof research that you guys saw there that Dr. Sexton and colleagues do. So dig into some of that, what really resonates with employees. And again, feel free to use that resource as a starting point too. I push that. That's highly underutilized. I was just one of our new nurse managers I went up to earlier this week and had a great big smile on her face that you could tell was kind of effortful. And I said, do you know about these things? Because she's, I guess I live here, well, here's some things that you can just take about 5 minutes a day that are good for your well-being. So yeah, I hope that answers the question. A long answer to
Yeah,
a short
it
question.
certainly does. Yeah, like we've seen in team steps and team training and lots of other areas, culture change just takes time. And having active champions, making sure people know that the resources are available, and really utilizing the early adopters to get some quick wins. It's going to help a lot for sure. Danielle Dunway and Rose Polaski had a couple questions about the volunteer program associated with the Caring for Each Other program, particularly how do you provide training and how often, and then also about the recruitment and retaining of volunteers for the program.
Oh, that's such a good question. Thanks. Yeah, so the peer support volunteer program has been going on for a little while, since I believe 2021. And it quite honestly looks different in the different hospitals. It's been a little bit more active at Duke University Hospital. We do have peer support volunteers in each of the entities. And right now we are in the process of kind of getting on the same page health system wise as far as how to actually deploy them. One of the practical things that we can do, we get reports from our safety reporting system every morning about workplace violence events, professional conduct events, and in our SRS system, we use the RL software. That's not a plug, that's just naming. I don't have any disclosures as far as that goes, but we have a box in there where the employee who's reporting the event can check, yes, I would like to speak to a peer about this, so that we automatically get reports on any of those that come in. And we usually do an email outreach. That's one of the things that we can definitely leverage our peer support volunteers for. At Duke University Hospital, I know we're 383 beds. Duke University Hospital is over 1,000, and we each have one program manager. So Ashley is going to take much greater advantage, I think, of her peer support volunteers over there, just because it's such a physically larger facility with so many more people. The peer support volunteer training is done by our department, by the Caring for Each Other team. It's a 2-hour training. A lot of it is back and forth, kind of facilitated conversations. We talk about supportive listening. We talk about listening to hear. We talk about being fully present, being empathic, and reflections and basic things like that help the person you're speaking with feel heard. For managers, we offer a little bit of additional training on top of that, because managers, if you've ever been a manager in the clinical setting, you know what I'm talking about. Managers have a lot of hats, and many times they're the front line for an employee who's really seeking help and really needs an ear. So we offer that training to managers as well. It's a one-time training right now, and after that's done, if we don't require the person, of course, it's all voluntary. We don't require the person to then be a peer support volunteer, but then if they want to be a volunteer, we'll do one booster session with them. And that's a one-on-one session where we have a conversation just to make sure that their listening skills are up to speed, and then we will deploy them as needed. But again, that conversation right now is ongoing. So that's part of our on the horizon sort of thing that we're looking towards. Thanks for that.
Excellent. And we have, I think we have time for one last question that just came into the chat from Melinda Pitts. They'd like to know, what is your process for handling the workplace violence and professional conduct safety events?
That's a great question. So workplace violence is multifaceted. I mentioned the behavioral emergency response team before, so our employees have the resource of the BERT team. If there's any sort of escalation in behavior from a patient or anyone else, our security staff here are amazing. They're very responsive. I work very closely with them because, unfortunately, sometimes there's a difference in the mental model of what security does, depending on who you ask, whether you ask security or you ask the frontline caregivers. And so there's a lot of conversations around how do we, I'm pulling a little bit of team steps here. How do we have a shared mental model of what security does, and make sure everyone is on the same page as far as who's doing what can we expect from our security team. But they're fantastic. They are all trained in CPI. They don't hesitate to go hands-on. And they get injured from time to time. So security people hold a special place in my heart. I round with them very regularly just to check in on them. So we have the BERTs, we have security. As far as workplace violence, we have, again, we get the reports on the workplace violence from our SRS system. So all of the program managers will proactively reach out to the people who were involved in that to check in with them and offer support. We're in close contact with the nurse managers of the units, because sometimes the SRS report doesn't reflect everything that happens. So we usually get in touch with the managers, make sure everybody's okay, and just kind of walk around afterwards. It's one of the nice things about being in a small hospital that I like is just, we hear everything. And so I can walk out of my office and walk up a couple of flights of stairs and be on any of the inpatient units, and go up there right away to check in on folks. And again, we have that 24/7 call for peer support and for our PAS system. As far as the professional conduct goes, there are a couple of ways to report that. I'm mindful of our time here. We have the SRS system. We have a professional conduct button, and that's generally how it comes in. And we have two individuals in the health system that handle those, one for the physicians and one for the non-physicians. There are two separate processes, both relatively effective. But that's how that's handled. But we also get reports on that, and we will reach out to the individuals involved if we feel like it was an emotionally impactful event. Yeah, thank you for that.
Excellent. Thank you for answering those questions. And thank you everyone for joining us today. If your question wasn't answered or you would like to contact Eric, his email will be provided in the follow-up you'll receive by end of week. So don't forget to complete the evaluation that will appear on your screen as soon as you leave. And if you're claiming CE credit, be sure to text TAKCEW to the phone number 919-213-8033. And with that, we will sign off. Thank you very much. Have a great day, and we will see you next month.